Okay, now one of the other conditions that runners can get issues with is the wonderful plantar fasciitis. Okay, so it's not just runners, I mean weightlifters, you name it, any particular type of athlete that may be involved in lower leg sort of loading. So let's talk a little bit about the anatomy first. So for Mon, she has got a very impressive plantar fascia. I don't know if you can see there, but obviously you can start to see the outline of that fascia through there. So obviously we have the muscles there. Sorry, Mon, I know that's ticklish. But what's important is that we can have pain in that plantar fascia, obviously at the attachment to the calcaneus. And we can also have it anywhere through this tissue through here. So it's important that we try and work out where that sensitivity is. Now, classic example of plantar fasciitis pain is usually first step when you get out of bed in the morning. It almost feels like you are walking on broken glass, okay? After about half a dozen steps, it starts to ease off a little bit. If it's actually really quite reactive, then you will feel it on most of the walking that you do that day, okay? And you'll tend to find that you'll start trying not to put much weight through there. So obviously that's not ideal for our athletes because they're going to start trying to shift their biomechanics, creates problems otherwhere. You know, we've talked about Achilles tendon pain and obviously medial shin pain as well, the shin splints. These three conditions can, believe it or not, coexist together. So it's not unusual that plantar fasciitis may be the third part of this overall condition that can present itself. It's not ideal. Once again, it's a temperamental condition, so a lot of the time there's no rhyme or reason for it, but for others obviously it is definitely related to load, so we need to keep an eye once again on that load. Now, techniques that are specific for plantar fascia, obviously we're going to be looking at the quadratus plantae muscle here, okay, and that can obviously have trigger points in that area as well. So we've got trigger point work we can do into that quadratus plantae, and what I'm also going to introduce you to is some vacuum cupping. Now this works an absolute treat in terms of working this plantar fascia, because a lot of the time this particular condition, obviously because it's called plantar fasciitis, we're obviously relating that to the fascia of the foot. This works just a treat. Now it won't always work on every client that you get, because sometimes for whatever reasons clients' feet may be just really dry. If they've got really dry, it makes it difficult for the cup to actually suction on. So for those of you that aren't familiar with this, obviously we're looking at using a vacuum cup, okay? So this is the gun, and obviously that is the actual cup itself. So it obviously adheres onto the skin itself, okay? So obviously it doesn't tear the skin or anything like that. It is just a lifting and offloading, okay? So what you can do with your vacuum cupping, okay, we're going to use obviously the smaller cup here, so they come in different sizes depending on the area, but this actually works a treat for plantar fascia. So one squeeze, and then you're just looking at working up and down the plantar fascia itself, okay, up to the calcaneal attachment, and then down and up. You can work across as well. Now what you'll find is that you'll feel almost like bubbles underneath, okay? Now obviously they're not bubbles, okay? It's just part of the tissue being lifted and offloaded, okay? Now if you can get in here and keep working this tissue with this cup, then you'll find you'll start to loosen off a lot of that fascial restrictive component to plantar fasciitis, okay? So it's just simply up and down, not rocket science, but it works an absolute treat, okay? And obviously disengage, you just pop it off like that. So I would always invest in some vacuum cups to make sure that you are being able to offload that area there. As I said, it works an actual treat. You can add a little bit of dorsiflexion and plantar flexion into it as well. Now, to come in technique wise for plantar fasciitis, we're going to come in once again with the broad forearm, and then we can sink down, okay? So I'm going to hold basically just where the Achilles attaches onto the calcaneal, and then we can work along the tissue itself, picking up pretty well much the entire plantar fascia and working right up to that forefoot, okay, and across. We can also hook in and work that quadratus plantae trigger point as well, just sitting on there. But I do like to work the entire plantar fascia after I've cupped it doing it this, and this obviously will make a big difference. Working across like so. Okay, quite simple. Now once again, it's all about creating this environment to make sure that the sensitivity on these attachments obviously are offloaded. When we're working by the plantar fasciitis, Achilles tendon pain, or even the medial tibial stress syndrome, it is important that we're also working the lateral compartment of the leg, and we're also hitting that tibialis anterior muscles as well. That should always be the recipe, okay? And then we just basically isolate each one of these areas for treatment. Okay, so now we're going to look at a stretch for, well, the plantar fasciitis, but also the Achilles specifically, and it's a great stretch. And as you can see here, Mon's in the position here where she's basically got her toes in flexion, so it is going to stretch all this tissue here and also the Achilles as well. Don't forget, this is a sustained stretch, so obviously you can sit in that position for quite a while, but once again be mindful of how long and how often you do this, because if you do this too much, and if you've got an aggravated plantar fascia, it might actually make it a bit upset. So we want to do this in a symptomatic free environment, okay? So obviously with the toes in flexion, and there's not going to be any compression or soreness through the toes, and also at the plantar fascia as well. Okay, so this is a great exercise for plantar fascia. I know there's quite a lot of material out there about, you know, stretching the plantar fascia, as we showed you beforehand, the exercises, but this is by far the best one. I find this really quite effective in mobilising all of the plantar fascia. So what we're going to do here, and Mon's going to go through it here, she's going to demonstrate, we're basically going to move the foot across the ball as opposed to up and down, okay? Now the reason for this is that you're going to get a much more significant and more compressive than you will when you're working up and down. So I might just go backwards and forwards across, so like so. Okay, now what we do is we can slowly move the ball down, okay, as we're working across. Now once you get used to this, you can really pretty well much put most of your body weight through this, so it's a really great exercise for mobilising that plantar fascia.